Good morning. I'm Dr. David Kaemmer, Chief Medical Officer for the Kansas City Division of the University of Kansas Health System. I'm filling in for Dr. Stites in this week's episode of Open Mics. Today, we're exploring a bacterial disease that can infect both humans and their pets, and especially our four-legged friends, dogs. It's called leptospirosis, or sometimes just lepto. And it can cause a range of symptoms from mild to life-threatening. And we're about to meet two people who acquired this infection. One says she got a mild case from her dog, but the other endured a truly life-or-death experience. I'm happy to say Mr. David Kaemmer survived his severe lepto infection. He joins us alongside with his wife, Sarah. Since this is an infectious disease, we thankfully have someone, you can't trust the surgeon to talk about this all the time. We need an infectious disease specialist, Doc Hawk, here at the desk. Thank you all for coming.
Thank you.
Also joining us remotely is Amy Anderson, who you might recognize from KMBZ Radio. We'll hear her story in just a minute. But first, David and Sarah sat down with reporter Janine Kiesling to explain how their anniversary vacation likely led to his lepto infection.
That trip to Jamaica was right before Thanksgiving 2022. When they returned, David's health started deteriorating. The Monday after the holiday weekend, David's wife Sarah drove David to the hospital. Neither of them had any idea David would spend the next 39 days in various hospitals fighting for his life. In Jamaica is a popular tourist attraction. David and Sarah Kaemmer describe it as a natural water park and were excited to go with friends while vacationing nearby. That was November 16th, 2022. On November 28th, David was admitted into a local hospital with flu-like symptoms and a mysterious rash on his chest.
I was put on an IV and I was in trouble. As you look back, my kidneys were failing significantly at that point.
David says he doesn't remember a lot of what happened, but his wife Sarah was by his side, and when doctors at the first hospital couldn't come up with a diagnosis, he was transferred to a second hospital.
I mean, he was out of it. He wasn't aware of anything going on.
Doctors at the second hospital weren't having any more success in making a diagnosis. On Wednesday, he was moved to the ICU. His organs were failing. On Thursday, David was put on a ventilator. At that point, doctors told Sarah they were out of ideas, and David needed to go to the University of Kansas Health System.
Well, when we got to KU on that Friday, I mean, like from the moment of him getting in there and the team of doctors and the nurses and the whole staff was amazing.
Infectious disease doctors took the lead, but doctors from various departments were involved in David's care to stop his organs from failing as they worked towards a diagnosis. At the same time, Sarah was talking with her family, many of whom were in the medical field. Sarah's uncle suspected David had leptospirosis. At the same time, doctors at the University of Kansas Health System were testing for that exact bacteria transmitted through the urine of infected animals.
Yeah, so he is a retired veterinary microbiologist from the University of Minnesota and wrote his doctorate on leptospirosis and was part of the team that helped with the vaccine for animals.
Doctors confirmed David had the most serious of leptospirosis, called Weil's disease, the only case doctors at the health system had ever seen.
That, like, where the major organ failure happens. It's just very rare for lepto to turn into such a devastating scenario. Why it happens, they don't know.
But doctors refused to lose David and were not only able to stop his health from deteriorating, he started to improve. David was transferred to a rehabilitation hospital on Christmas Eve. He remembers feeling better and being able to communicate with doctors before his release. He still gets emotional thinking about it.
Well, they asked me to come up with a word when was that on the day I got taken off?
The doctors, they took out the ventilator and they said, "What is the first word you think of?"
And I said, love.
Well, David and Sarah, take us back. That's not fun to relive, is it? It's kind of emotional. I really appreciate you both being here and sharing with our audience. This is very important, and thank you so much. Can you take us back to the first day signs, everything, something was wrong? How quickly did it go from flu-like symptoms to organ failure?
No, it was, we got back the Friday before Thanksgiving, and I would say the following Friday after Thanksgiving, it was getting scary.
No. And then that's when you headed into the hospital soon thereafter?
We managed the weekend via telehealth and tried checking for COVID and RSV, and she got Tamiflu, I think it was from Walmart, through telehealth. By Monday, it was like,
There's more going on.
Yeah.
we need a chest x-ray because we thought maybe it's pneumonia, just kept chasing issues. And when she was driving me for a chest x-ray, she said, I think we just need to get into a facility.
Gotcha. So, obviously Dave was the patient, but we know behind the patient, there are patients as well. You're
Yeah.
going through this with him,
Right.
with a loved one, and it's sometimes tougher waiting and seeing as a loved one. How did you cope emotionally with that? And what did you do to kind of, seeing him critically ill and sedated and intubated, how did you deal with that?
Well, definitely nothing you plan for. Lucky to have our 4 kids and our parents and lots of family and friends that were there to support us. Definitely had faith. They kept us going. And then also knowing that we were in the right place when we were at KU, that, we definitely had confidence in the team there to help. So, you kind of go into fight mode, You just, there just was no other option.
Right.
So you
And we have
just stick with it.
Friends that are in medicine, and that little board of directors she
That
put
helped
together.
me
that helped her.
understand.
Yeah.
I didn't.
They said, we got to get him to KU. One of them is an organ transplant nurse from college at University of Kansas. We both went to KU, and he was, these folks were big advocates for how we got to get here. And then
Yeah.
through the network and self-advocacy, or not self, but the team advocating for me, we
Yeah.
were able to get down here.
Yeah. Well, we're glad you were able to make it here.
Oh, yeah.
You share a picture of a board where you wrote out daily blessings while David was
Yeah.
hospitalized. I see weaning ventilator settings and discontinued meds for AFib on there. Also, decorated room with a Christmas tree. Such a great idea. So what did this blessings board mean to you and your family?
Well, it was a friend that had the idea, and it was to give hope, really, just every day to be thankful for little steps of progress that he was making, to be able to share that with family and friends, and also to make a connection, I think, with, the nurses and doctors, to let them know, who he is and who he means to people.
Yeah, that's a fantastic idea. I
Yeah.
wish more people did that. That's
Yeah.
really a great idea.
And we also posted pictures on the wall and did a whole collage just to see who he is.
Yeah.
And as the patient, as I started being around
Waking
again,
up.
people would come in and ask me about the questions and ask me to explain who's who, and they love the dogs, and it just became very, to me, just people weren't just walking in to poke me, they were walking in to hear me, the story,
Yeah.
which was
Yeah.
cool.
Yeah.
Yeah.
Doc Hawk, turn
Hi.
to you. In the video, we said lepto is spread via animal urine.
Yeah.
How does it end up reaching humans?
Yeah, I think that's a good question. Again, it is in the environment, the bacteria. It is really perpetuated by animals. What happens is the animals urinate in the environment, and people come into contact in the environment through the animal urine. I remember one of the first day that I actually was seeing you, and you were in the room, and we talked about what his risk factors were for the infection. And I got to see those videos, and I got to see the pictures of you in the water. It was in jumping into the water, but also going through creeks. And we know this is a very common point of exposure for a lot of people. If you know about those people that are in those eco races where they are going through the jungle, a lot of them come into contact with creeks. We know that leptospirosis infections in those cases do occur. And so it's really through the environment, especially water sources, when you have animals close to there urinating and it gets in the water. And then humans come into contact when they go into the water.
So that obviously, swimming in Jamaica, the blue hole, could be a possibility of an infectious source, correct? correct?
That could be one, and I think you guys were walking through creeks as well. So I think those are probably going to be the two biggest sources there, yeah.
So David and Sarah shared a picture of his yellow and jaundiced eyes. That's a big sign his liver might be failing. Doc Hawk, with a severe case like David's, what was the treatment?
Yeah, I think that is one of the good things. So here at the University of Kansas Health System, we probably actually diagnose 1 to 2 cases a year of leptospirosis. We certainly check for it all the time, especially during tick-borne illness season. And what we do find is that the nice thing is that for our tick-borne illnesses like Rocky Mountain spotted fever and ehrlichiosis, but also leptospirosis, the treatment is simple. Doxycycline, which is a very common drug, and it's an old drug, but it still works. So he was able to get treatment with doxycycline, and that is what really helped him. Also, of course, the supportive care when he was having the respiratory failure, needing to be on the ventilator, and of course the renal failure as well.
So getting through the acute phase is one thing, but David also needed time after his extended stay in the hospital and at an inpatient rehab unit. David, what was it like rebuilding your body and trying to walk again and just doing the normal activities of daily living?
Yeah, it's different. You can't believe, and even looking back, talking with the family last night about today's show, just rehashing it, that like you can't believe you can't move, right? And so, I have a huge appreciation for PT and OT and the rehab scene. I've had to rehab my knee from a scope. That's nothing, man. When you're down and out and you got this team of folks that are showing up in the morning, you kind of aren't so excited when they're showing up, but they get you up and they start moving you around and they help you do things that you didn't know you ever were going to need help doing. So they're special people to me to put one foot in front of the other again. It's a journey, that's for sure.
Yeah. We often think in medicine that one day in the ICU equates to at least 2 days, maybe 3 days of rehab on the other end, and it's hard to equate that, but you really do become deconditioned.
That's right.
So really strong, healthy guy. What was it like watching him make progress through that and really have a tough time, but eventually get there?
I mean, it was definitely difficult. It's, just seeing him in a different state like that, but I knew his personality and I knew he would not give up. Took a lot of patience and encouragement, but I knew he wouldn't give up. That just wasn't him.
Yeah.
So,
well,
which was part of the reason in the hospital, like, that was just our attitude. We can't give up because he wouldn't.
Yeah, very strong will. That's fantastic. Let's bring in Amy Anderson to talk about her lepto experience. We didn't get this opportunity very often in the show, but this is our chance to look at some cute dog photos. Amy, tell us about Archie and how he might have caught and spread lepto.
Oh, poor sweet baby. So he was 12 weeks old and he was lined up to get his vaccinations. He had not had his lepto vax yet because he was too young. And he was scheduled to go in like the next week or two to get those vaccinations. He was outside in our backyard. This is what we think, playing. He's a troublemaker. He was rolling in big, wet, muddy puddles in our backyard, as puppies do. And we think that's how he got it because we have had families of foxes in our neighborhood. And they were having their babies around this time of year. And there was just a lot of, you can hear them at night, you can see them on ring cams. So we knew they were out there. And the working theory seems to be that, that they were urinating in our backyard and he was rolling around in a puddle with that urine and he got sick.
So what did you notice first? Was it Archie's illness or yours?
It was his. He, he was this rambunctious. I mean, a 12-week-old puppy is a crazy little thing to be around. And he just one day I noticed he was just sleeping a lot, and then he stopped eating, and he just was not acting right. And we took him to one emergency vet, and they said, oh, he's probably got, like Legos in there. He probably ate one of the kids' toys. And they took an X-ray, and they said, yeah, we do see an object in there. He'll pass it. it's not that big, and they sent us home. And he got worse and worse and worse to the point where he wasn't even standing up anymore. So we rushed him to a different emergency vet, Mission Med Vet down on Johnson Drive. And she said, I don't think this object is what's causing the problem. And they kept him overnight. They called me at work the next day and they said, you're probably going to have to put him down because his organs are failing and we can't figure out what's wrong. And she, at the very last minute, it was like a Hail Mary. She said, I'm going to try to treat him for lepto and see what happens. We won't know for a couple weeks if he has it because of how long it takes to get the tests back, but we're going to go ahead and treat him for that just to see. And I was like, please, just try anything, do anything you can to save him. And she called us the next morning and said that his kidney functions had improved 50% overnight just from being on the medication for lepto. So that's when we knew he had it. And it was just a few days later, I started feeling kind of like I had the flu, only a little bit worse and kind of strange. It was, I haven't felt it since, thankfully. It was like the flu, but slightly different, if that makes sense. I did not feel good at all. And I happened to be reading a lot about lepto, and I saw that it can be transferred to people. And that's when I reached out to KU for some help.
Yeah. Great catch by the vet. I mean, and then were you warned a little bit about you could potentially get lepto when your dog had that?
We talked about it a little, and but it wasn't until I was kind of reading, I was doing so much reading when we found out that was what he had, and it, said in all the articles I was reading that you have to be very careful if you have an animal with lepto. And then they put him in quarantine at the vet's, and we had to wear gloves and masks to go in and visit him. And I started to wonder if that's what I had when I started feeling so strange and so bad. I really felt awful.
Yeah. So were you the only one in the family that got sick? Anyone else get sick?
Thankfully, I was the only one, but I was the one that was constantly holding this 12-week-old puppy, and he was always kissing my face, and I carried around constantly. So it doesn't surprise me that I was the only one that got it, and thankfully, my husband and the kids were out of town that week to go see some of his family in Chicago, and so it was just me and Archie here. So it actually ended up working out well. It was just the two of us recuperating.
Gotcha. Well, our program usually focuses on human health, but I should acknowledge there is a new lepto vaccine for dogs in the market. If you do own a dog, it's something you may want to talk about your veterinarian about. Doc Hawk, Amy had a mild case. David had a life-threatening case. Why do some people get sicker than others, and why does some people not get sick at all?
Yeah, I think there's not a good answer as to why some people get sicker than others. Certainly we know that wild disease, the severe case that you had, only occurs in 5 to 15% of people who actually have leptospirosis disease. So you definitely got the short end of the stick, unfortunately. I don't think there's any real good way or mechanism that we know that one person will just develop mild disease, while a very select few will develop more of that severe disease, unfortunately.
That short end of the stick, it sounds a little bit more than a short end of the stick. You might get beaten with that stick, it sounds like.
It did.
We are here to answer your questions. Please send them in using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's switch gears and talk with Doc Hawk about some other infectious disease news. First off, new COVID vaccines are coming soon, formulated for the KP2 variant. Can you talk about us a little bit about that?
Yeah, absolutely. So we know that the COVID updated 2024-2025 vaccines will have been FDA approved, are probably out of the warehouses for the companies, and are probably making their ways to the pharmacies and the health systems. We know that in the summer, the FDA recommended to do the JN1 variant as the formulation for the new vaccine. However, soon after that, nicely, a few weeks after that, they recommended that the formulation be based on the KP.2 variant, which I believe it is now. So we are waiting for those vaccines to become available. We know that initially there's probably going to be a high demand for those. We will have them available at the health system. They aren't available just yet, but I have been in conversations with our pharmacy, so we are hopefully going to be expecting those in the next week or two. And again, the recommendation is that everyone 6 months and older does get this new 2024-2025 updated COVID vaccine.
So it's going to be something that's just going to be with us here long term.
I believe, yes, it will be with us long term. It's really unclear, will it just be one season? I think we will see seasonality, but I think it could end up in any season, really. And I think we can have maybe various cycles throughout the year. Obviously, we've had this summer surge. Are we going to have a winter surge as well? I think we have to expect we might. So I think moving forward, it's going to be hard to judge exactly how that's going to be. Is it going to be just one peak a year? Will it be 2 or 3 peaks a year? I mean, the lucky thing is, though, we do have vaccination. We do have prior immunity from infection and vaccination, and of course we have antiviral drugs. As we've stated before, for the most part, the virus does not affect our daily lives, but we have to be sensitive to the fact that there are certain populations where it can still cause severe disease and hospitalization.
And we've probably seen a few peaks, so a lot of kids going back to school these times, so we assume that would happen.
Absolutely.
So I know you'll keep us updated on
Yep.
that. Thanks. Free COVID tests will be available soon from the federal government. We'll let you know when the online order forms can be submitted. Also, we saw Dr. Anthony Fauci was recently hospitalized and released for a West Nile virus infection. He said he's never felt sicker. Doc Hawk, West Nile is a real issue in Kansas.
Yeah.
We know of many issues. Can you kind of comment on that a little bit?
Yeah, certainly. Again, we are always in a battle with the world around us, whether it's the environment, like we saw exposure to leptospirosis, but we know also now we are in essentially tick-borne illness season. So that does include mosquitoes as well. Unfortunately, there are a number of viruses which have been in the press in the United States and abroad. I would say, though, that for Kansas, really what we're looking mostly at, especially for tick-borne illnesses, things like ehrlichiosis and Rocky Mountain spotted fever. Again, bacterial infections, we know they can be treated with the same drugs as we treat leptospirosis with. But for mosquitoes, really the main mosquito illness or pathogen we are looking at is West Nile virus. And we know that for the last 2 summers, and especially the 2023 and now 2024, we know that West Nile virus activity has been extremely high in the state of Kansas. So it is important to continue to practice good measures when you go outside to avoid being bit by mosquitoes, but also ticks. Those things include wearing light, loose clothing, long sleeves, short sleeve pants. We know it's hard to do in the summer, but certainly insect repellent is vitally important as well to help protect you against getting bit by mosquitoes and infected with West Nile virus as well. So.
Lots of bugs out there. Dr. Hawk has some job security, sounds like. We know you have many questions out there, so let's head to Studio B with Dr. Del Cid.
Dr. Del Cid, you gave me quite a promotion. Oh, I'll take it. But I've no business treating any patients, I'll tell you that. Amy wants to know, do petting zoos spread lepto?
You want to take that?
You know, again, I think we know that these organisms are in the environment. We know that the animals are the main reservoir. And so I think if you're going to petting zoos, I think it's reasonable that there could be exposure to leptospirosis. And this brings us to why it is so important to do one of those major pillars of infection prevention that Dr. Stites has always talked about and we've discussed. Adequate hand hygiene. So certainly if you are out in the environment, if you're going to petting zoos, if you're going to farms, any other contact with domesticated or wild animals that may be outside, I think it's important to continue to practice good hand hygiene. That includes alcohol, hand sanitizer, or soap and water. But I would say the answer is probably yes. There is probably some level of exposure. Does that mean you can't go to petting zoos and enjoy? No, not at all. But just make sure you're taking those precautions when you're done with the animals or done at the petting zoo for the day as well.
Jeremy has a great question. Jeremy wants to know, are there common regions where you're more likely to catch lepto, or anywhere you could check how common lepto is when you go on vacation? That's such a good question, because a lot of people are probably rethinking whether they're going to go swimming in natural places on their vacation after hearing David's story.
Yeah, I think that's a good question. I don't know that there's any necessarily levels of lepto detected that I'm aware of. I would say that it's probably a ubiquitous organism, meaning it is all over the United States, as opposed to some regions of the United States that may have more viral illnesses spread by mosquitoes than others. I would say that lepto is probably going to be ubiquitous around whenever you're having contact around either domesticated animals, farm animals, or wild animals. If you're having that exposure in the environment, it's probably going to be more of a ubiquitous exposure.
We have one more question from Marie, who wants to know if she's heard this and wants to know if this means that she's at a greater risk for catching it because she works at a doggy daycare.
I would think that, yeah, we've just heard this story from Amy about her dog. So I think it is reasonable, but I think you can take those precautions. And hand hygiene is going to be the best thing for you and your family. If you're working in an area where there are animals, make sure to keep those areas clean as much as possible. But it does come back to you as that person, and I think the biggest issue is going to be, hand hygiene. Probably try to avoid eating in areas around the animals if you can as well, and those will help decrease your risk. But I think just what we saw, Amy's dog was out playing in the backyard, so there was exposure there. There's no reason why other dogs couldn't get exposure. Luckily, this is not a common illness, but I think it is important to be wary of it and understand. But also understand that you can protect and reduce your risk as much as possible.
Joellen has a question, changing gears, about COVID. Joellen wants to know, Dr. Hawkinson, she remembers hearing something a while back about COVID possibly affecting the COVID vaccine, possibly affecting mammograms. Can you talk about that, what Joellen is referring to?
Yeah, I thought we had done some shows on there where maybe they had showed some lymphadenopathy or increased lymph nodes. Don't remember exactly about the COVID vaccine affecting mammogram and the breast tissue in that way. I think we could probably get an answer to that question. But I know there was some mild changes on the mammogram possibly, but any of those changes would be transient and wouldn't overall affect probably the final report. But I think we can probably get an answer for that from our breast imaging experts.
And we'll do that, and then we can get back to people, the woman who had that question. One more question from Kathy. Kathy wants to know, will insurance or Medicare pay for the COVID vaccines?
So private insurance should pay, Medicare should pay as well. I think, I certainly know there are government programs for Paxlovid as well as company programs for Paxlovid, which is the antiviral. But in general, the insurance programs and the government programs should be paying for the vaccine itself. Now, if you go somewhere, there may be an administration fee that may not be paid for, but the vaccine and the vaccination itself should be paid for.
Great questions. Thanks, Doc Hawk. Appreciate that. Thanks, Dr. Del Cid. This has been a great discussion, but we want to get some final thoughts before we go. So, Amy, do you have some final thoughts?
Well, first of all, I just want to tell David, I'm so glad that you are okay. Your story is just horrifying, and I'm so grateful to see you sitting there talking with us this morning. Just incredibly scary stuff. I am very grateful for good veterinarians and good doctors. And if you start feeling strange, you guys can't figure out what is wrong, make sure you bring it up if you've been around a situation with animals like that. And the biggest thing I want to come out of this is to get your dogs vaccinated against lepto. The vaccine is cheap, it's easy. Like I said, Archie was just a few days out from getting his, and both my dogs get them like clockwork every year now. Save yourself the hassles of going through what we went through. If you have dogs, definitely get them vaccinated.
Thanks, Amy. Sarah, you have some final thoughts?
Yeah, I guess if you go on vacation or leave the country and you come home and you don't feel well, definitely get it checked out, and not just get it checked out, but tell the providers where you've been, and so that maybe they can say, oh, yeah, you know, that could be something, and to self-advocate for yourself. So.
Okay. David?
Yeah, to Amy's point, I mean, dogs and cats can be vaccinated for this stuff, right? So that's a really good action to take with your pets for their benefit, potentially for ours. And then I'll just leave it with this. Like, we went to a place, the Blue Hole, Dunn's River Falls, where Ocho Rio, the cruise ships come in, and hundreds, if not thousands of people can show up in these places every day. It is so crazy rare what happened to me. So super rare. We can't live our life scared. Thank goodness there's wonderful people in the world at KU and other places that can help you. And to Sarah's point, go in, self-advocate, let them know what you've been through. And if there was a sign that says there's a chance you could get this rare thing if you jump in this water, I would have jumped in the water anyway, right? So that's what I would leave, you know, and be strong and have wonderful doctors and family supporting you.
Great advice.
Yeah.
Thanks, David. Dr. Hawkinson?
Yeah, you know, I'd like to echo David's point. I was thinking that exact same thing. You know, we are in a constant battle with the environment around us, and humans have been in that battle as long as humans have been on the planet. Don't be scared. We are not trying to scare you. This is all to inform you, to protect you as much as possible, to allow you to make those decisions, but give you the best information to help protect yourself and your family. And there are simple things that you can do that we have talked about. Hand hygiene is vitally important when you go out into the community, when you go to petting zoos. Frequent hand hygiene is important. Stay up to date with your vaccinations. We give the recommendations. The recommendations are made because we know that the vaccines can help prevent serious disease, and we want that for you and your loved ones. So understand all of that information, take that into account when you're making your decisions, but by no means do we want to scare you. We just want to give you the most up-to-date information to keep you and your family healthy.
Well, Amy, David, Sarah, thank you so much for being on today's educational program. This is huge for the community, and thanks for entrusting your care to us here at the University of Kansas Health System. This is very important, as others have said. I'll echo, please, if you're not feeling well, seek out some help, seek out some answers, and if you're not getting the answers you think you should have, seek out more. Be your own advocate and have your family help you. Thanks again to all of our guests and to our audience. We'll see you next time.
Coming up Friday on the Morning Medical Update, COVID numbers are up, along with hospitalizations, just as a new vaccine comes out. I'm Jessica Lovell. Join us Friday for a special Open Mics with Dr. Stites, along with other chief medical officers, to hear what's happening at hospitals in our area. Plus, Hawkeye explains the new variant and when to get your shot. Bring your questions as we talk COVID and other seasonal viruses heading our way.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.